Welcome to LabCast, a podcast about the medical laboratory science profession, brought to you by MedLab Convo. To get notified once we drop an episode, you can do well to subscribe to all our social media platforms at MedLab Convo. For questions, feedbacks, and shoutouts, you can do well to send a mail to at medlabconvolabcast@gmail.com. Thank you for listening.
Think about the last time you made a mistake, a real honest mistake. Maybe a misspelled word, got your keys, or missed a deadline. Now imagine if those routine everyday mistakes carry the weight of a human life. In the medical laboratory setting, a single misplaced decimal point or a misread slide or a swap sample tube isn't a minor slip-up actually. It is a potential catastrophic medical error, and that could be grievous. Medical laboratory scientists carry this intense zero pressure every single day, mostly out of the sight of the patient they even protect. Or what happens when the human beings behind the analyzer starts cracking under the pressure? And today is going to be quite interesting because we'll be diving deeper into all of these things on this episode. We'll be stepping away from the results report to look at the professionals themselves because they actually matter. We are breaking the silence on the mental health crisis inside the laboratory, the chronic burnout, the anxiety, the somewhat toxic culture of perfectionism that isolate the very people keep healthcare system afloat. I am Jesutomisin, your host, and here with me is my co-host Pius.
Hi everyone, I trust we are fine and our day is going on well. This is no doubt a heavy topic as we can see. It is deeply necessary. And to set the stage, we'll play our signature game. Yeah, two truths and a lie. And you are going to drop your guesses in the comments right now. Statement 1. Healthcare workers who work shifts longer than 12 hours double the risk of experiencing severe clinical anxiety and depression. Is that true? Statement 2. Medical laboratory scientists reported lower psychological distress levels than clinicians because we don't handle patients directly. And then statement 3. Over 75% of Nigerian medical laboratory professionals experience symptoms of severe burnout every single week. Now you need to lock in your guesses as we are going to reveal the lie and the truth later in the episode. But for now, let's introduce our guest. And returning to the studio is a familiar voice, one who has been on this platform. His name is Praise-Jah Ewa, a medical laboratory scientist who is passionate about giving voice to the mental health struggles we face in the lab. And he calls it a gigantic mental health crisis. Praise-Jah, welcome back to
Thank,
LabCast. It's great to have you.
thank you very much for having me. I will want to start by saying that everybody talks about pressure in the ER, in the emergency room, in the ICU, in the hospital, but there is a room in every hospital whereby pressure does not make noise. In fact, the pressure there makes numbers, and those numbers decide if a patient lives or dies. I work in that room because I'm a medical laboratory scientist, and we are here to demystify the mental health crisis and to dive deep into the pressure that we face. Nobody talks about it, but today we are going to talk about it.
Awesome stuff. I love the energy. Bring it on. Yeah, this is going to be awesome. Let's talk about the weight of an invisible bench, right? Scientist Praise-Jah. Because medical laboratory science professionals work behind closed doors. Patients rarely see us. They rarely know us. Sometimes they don't even know us. In fact, in the year 2018, Dr. Rhodes' article concluded that medical laboratory scientists are the unsung heroes behind patient care. How would you that sense of isolation impacts a scientist's day-to-day mental health?
Yeah, that sense of isolation impacts it a lot. But to delve into for this conversation to be very productive, in my preparation for this conversation, I outlined the kinds of pressure that we medical laboratory professionals face, and I itemized them into four. To answer this question, I want to outline these four. As an MLS, especially working in Nigeria, we face number one, volume pressure. Number two, clinical pressure. Number three, invisible pressure. And number four, financial pressure. You see, the answer to this question you ask falls under what I've called the invisible pressure. Invisible pressure is we are carrying the bad news alone. The doctors and the nurses are the ones that the patients see. They get the thank you. Oh, John, thank you for saving my life. Nurse, I've never met anybody like you. But the only time they will call a medical laboratory scientist is when something is wrong. In fact, most of us agree with me that sometimes when you see a consultant stopping into the lab or you see a call, you know that there is big trouble. You see, what now happens when this invisible pressure comes? We don't get to see patients, but we see their HIV results positive. We see cancer that we know that, oh, this cancer has metastasized. We see hepatitis positive results every day. And then we carry the bad news. Already, studies suggest that medical professionals have 40% increased risks of developing depression. Now, think of those unseen heroes. We that they talk as lab guys, that they just say, go give the lab guys a sample in the lab. Think of how that will now impact our mental health. We can't be alone. We don't get to see the patients. Sometimes there is no thank you. So this isolation, it's just like someone that you put all your load on and the person doesn't have anywhere to put the load. So we are drowned in that. It's like we are in what they call solitary confinement. People that are in crime knows that where a prisoner is just on his own. You won't even see a gecko. So that impacts our mental health so much. And of course, many of us are drowning in our places of work.
I really love what you said, and you mentioned indirectly that the clinical system expects us to function flawlessly and tirelessly around the clock. My question is, how does this expectation of perfection, how does it breed a unique kind of chronic anxiety in our field?
You see, the expectation of perfection can bring chronic anxiety. And remember, I said that there are different kind of pressures that we face, right? I've talked about the invisible pressure where nobody sees us. Now, there is another kind of pressure that we face. Now, that kind of pressure is what I've referred to as clinical pressure. The clinical pressure is that a medical laboratory scientist is supposed to always give an accurate result. Remember, we work with ART, accuracy, reliability, and timeliness. That's our watchword. We have zero tolerance. Now, it means that when something is going wrong, our heart will be pounding. For example, some of us work in critical care in the ICU. They are waiting for you to bring a cardiac parameter. Let's say a patient has cardiac arrest and they're waiting for you to deliver a cardiac parameter. But by the time they listen to you, you see that whether the sample is too small or there's lysine or there is they are waiting for you to administer a potassium result that will mean the kind of insulin that will be given or glucose sample or even emergency cross match, and something is wrong with that result. It's wrong with the sample. Already, you are thinking, hey, they need me now. This is life or death. If I make a wrong call, these patients can die. If I tell them that this sample is not enough or something happens to this sample, they will think, already that pressure to always deliver. It's called that perfectionism culture. It weighs us down. And if care is not taken, sometimes some colleagues have made a bad call. It could lead people to think of falsifying a result or altering a result, which as medical laboratory scientists, we cannot do. So that pressure is a lot. The pressure to always, it's called the clinical pressure, zero tolerance. And it really weighs on one's mental health, especially if you've worked in the clinical setting.
Absolutely. I couldn't agree more, or agree less with you rather. So, as this clinical pressure builds up, expectation rises from various dimensions. And what follows actually is anxiety. And do you think the fear of making a diagnostic error causes scientists to experience severe imposter syndrome, most especially when they are highly competent?
You see, that imposter syndrome is, can I do this? Can I not do this? You see, the higher incompetence you have proven to be, they say the result for work is more work, right? The result for work is more work. And the fact that scientists sometimes are viewed as the infallible guys, we are viewed as, and mind you, it's no mistake that in the medical world, blames are always shifted. People don't want to take blames for something that has happened before or a mistake whether in the sample collection or treatment regimens or in patient's care. And many times it comes down to the scientists. And our training, we're always trained. No, you cannot make a mistake. No, you cannot do this. And it means that sometimes we are just humans. Yes, we punch machines. Yes, we take this thing. Even the best scientist in the world has made a mistake. I remember when we were trained then in the Kempat lab in University of Lagos University Teaching Hospital, Lot, where I trained. One of our senior scientists there was that how he goes about his day is that he tells himself that even though he knows that during his line of practice, there is no way he will not have killed somebody. He knows that there are 1 million people he has saved. Now, that is not a negative way of thinking. It's just that he tries to calm himself down that there's no how he will not make a mistake. But he tries to limit it and pick himself up over and over again. So even no matter the level of competence, there is, as far as it is not medical negligence, mistakes are common. And that's what I talked about before in the clinical pressure, because this clinical pressure is a lot and everybody puts it on medical laboratory scientists. They feel they cannot make a mistake, but you can. But as far as you're not negligent, it's okay to make a mistake. But if you follow all the standard operating procedures, the mistakes can then be detected and then we can follow up and correct it.
Let's start looking at this solution. I really want to hear your thoughts. When we look at labs that are chronically understaffed and scientists are pulling back-to-back calls, where do you draw the line between building professional resilience and actual institutional exploitation? Where do you draw that line?
You see, this is a very, very big topic. And I don't know if time will not permit us to talk too much on that. Building professional resilience and exploitation, they should not even be in the same sentence. Professional resilience is making sure that a professional is working up to his full capacity, or at least up to the average capacity that is needed for him to work. Now, when you are now doing the other one, it means that you are now making sure that you are stealing from them. That is exploitation. And believe me, exploitation happens in at least 70% of the laboratories in Nigeria. Why do I say this? You see, staffing in laboratories in Nigeria is not based on needs. It's based on how much money they loan particular staff. And then that's why you will see that only one MLS is in a laboratory. It's processing 200 to 500 samples per shift. That MLS is doing 100 urinalysis per day. That MLS is doing 60 full blood count. Just put it in the analyzer and let it go. That same MLS is doing culture. That same MLS is the phlebotomist in the lab. Now, what this means is that you cannot tell me that you are building professional resilience with making one person do that. That is total exploitation. So where that line is supposed to be drawn is according to the needs of that laboratory. there should not be one scientist on a bench. You can say, oh, supervisor, at least for a particular laboratory, there should be at least 3 that are in shifts, especially if they are doing more than one specialty. You cannot tell me one laboratory scientist will do micro specialty, will do hematology, will do pathology. That line is a very clear line. But of course, because we are in Nigeria, exploitation is easy when there is scarce resources. There's no scarce human resources, but there is scarce mineral resources in that people don't even have enough to eat. So then when there is not enough to eat, the scavengers come, and then when they offer you peanuts, you take it. So it is supposed to be a very clear line, but it has become relative. No laboratory scientist should work alone on the bench, of course, because of one of these errors we have talked about. But it happens, and exploitation is now the order of the day.
That's quite sad and unfortunate that the exploitation is on the high side, right? So let's take a look at another angle for burnout, which is the mental fatigue. There are elements that contribute to this. So how much do the physical and sensory elements of the lab, such as the constant alarms, the chemical smell that are quite hazardous as well, and the harsh fluorescent lighting, how do they contribute to subconscious mental fatigue?
You agree with me that the laboratory is no 5-star hotel, right? Even in the standard laboratories, you have alarms ringing. There is always a stop timer. There is always an incubator. There is the smell of chemicals, and some people are chemically reactive. It can cause chemical arthritis to some people. Some people have some photosensitive conditions. You agree with me that there are some photosensitive porphyrias and even photosensitive epilepsies. And even some people have become so accustomed to hearing that stopwatch, kirin, 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 that they have, in fact, it always rings in their ear. Some of us that have worked overnight, that have done call duties, that have worked in blood banks, whereby you need an emergency cross match. When they knock on the door, sample, many of us have become light sleepers. I remember there was a senior colleague of mine when I was still working in one of the private labs and some years ago. She said that she started using glasses because of the eye strain from microscopes, when, of course, that was the yesteryears, when we didn't have these microscopes that we can connect to a monitor right now and just and you can see it. She started using glasses because she trained her eyes to look at blood films. So the sensory elements, the fluorescent lightning, you can even as a danger of nosocomial infections. Believe me, in the laboratory. So these are most of the things that it causes mental fatigue. Imagine you are now in this kind of place. As I described before, it is not a 5-star hotel, right? And it's not meant to be, because you're not there to relax. Imagine you are now there, what we talked about previously, the exploitation. You are now there. Some people do 24-hour call. Some people do 48-hour call. Imagine you're now there for 24 hours. For 48 hours, whereby you just go into the changing room and just slip on any clothes. You use mouthwash. You don't even have time to brush your teeth. And then you come out. Please, you agree with me that sciences cannot work optimally. Mental fatigue are setting. Law of diminishing returns are setting. And unknowingly, he or she can start putting out inaccurate samples. And it goes against our motto of accuracy, reliability, and timeliness.
And just to add, we are young persons at the same time. We happen to, also have young persons around us. I don't know if you've noticed a trend of young scientists who are experiencing severe physical symptoms of stress, like chronic headaches or sleep disorders, early in their laboratory careers.
Oh yeah, I have. And maybe you see I'm very passionate about this topic because I have friends that are passing through that. Um and there's a friend of mine that every time he calls me, he's working in a private lab. No, in fact, he's working in a government institution that the pay is nothing to write home about. And he talks about how stressed he is and what he has to go through to make sure that samples are this. And Many times, I just know this guy is tired. And I've had some other friends, of course, I don't want to mention some names here, that have even had to resort to recreational use of drugs, which we know is the number one cause of psychopathy these days. So many young people, in fact, when I was doing my internship there, and I don't want to mention the facility I did that, there was a time we went to the clinic and we took the blood pressure of nearly all of us there. 50% of the young guys that were there, because we wanted to play a football match, and they mandated that before we went to play a football match with the pharmacy department, 50% of the young guys that were present there had a blood pressure, a systolic blood pressure above 145 millimeter mercury. And that is pre-hypertension. And then it was like, what is going on? Yes, we were stressed, but we didn't even realize what was happening at that young age. So believe me, some young people are very stressed. Some are going through anxiety, some because of lack of pay, some because of the sample overload, and some has even gone to start taking recreational drugs to just make them feel well. So this is a big issue that many people don't want to talk about, but it's bigger than we are looking at it. It really is. And I know people that are experiencing that.
Oh my God, that is so disheartening. Oh my God. Can you imagine that? Going through all the stress, and at the end of the day, you've done everything right by the books, everything is clear, and there is a glitch somewhere, and the first blame game goes to you as a person. Isn't that so bad? So let's take a look at this blame culture versus the psychological safety. Just like you mentioned earlier, in many diagnostic facilities, the immediate reaction to a laboratory error is individual blame and penalty rather than the system analysis, rather than the root cause analysis. How does this lack of psychological safety damage team dynamics?
You see, about this blame culture, we are taught in quality management system that we do a root cause analysis, that we do preventive actions, that we do corrective actions, that we do remediative actions. But believe me, because of, I said before, that in the medical space, especially in Nigeria, there's this shifting of blame. And I feel it has affected us in the lab so much that even errors that are not our own, we blame each other for that. And now I'll give you a shocking statistic. Do you know that 70% of the laboratory errors are pre-analytical? It means that most of the errors that you see in the lab, it will not actually happen when the MLS receives the sample or is processing the sample. But at the end of the day, the MLS gets blamed. Now, sometimes by the doctors, clinicians, nurses, what have you, but sometimes even our senior colleagues. And then you will see things like, they are not this Gen Z, they know they are not working, they are not serious, they are not this, they are not that. Instead of going through the corrective actions, instead of going through, okay, let's do a root cause analysis. What happened here? Is it that you didn't properly log in this sample? Is it that this sample lies? Is it that when you were centrifuging sample, you didn't properly separate the plasma from the whole blood? Were you supposed to use plasma and you use serum? What is the actual problem? But because we have that blame culture, and believe me, in Africa, someone always causes something. Something is never wrong on its own. That blame culture is in our mind, and it creates helplessness. It creates helplessness because once a mistake is made, you don't even know where to go. And when helplessness sets in, do you know the next thing? When someone is helpless, the person wants to react. It is now a knee-jerk reaction. The person wants to say, hey, okay, what did I do wrong? Well, all glucose samples, it will be normal. Let me just put 4.5 there. This sample has poured, though. They will blame me. Let me put 4.5. And that patient was actually having a glucose of 6.9. And then you are putting 4.5. The doctor takes the patient off his insulin medication. Now, what has happened there? So unless this blame culture is shifted, unless helplessness is stopped, and unless we start looking at ourselves as human beings, as people that are mentally drained, it will start causing issues that are spiraled into the rot and the gigantic issue that we have in the medical space, especially in the laboratory space.
Wow. I really love this aspect because it's something I can relate with as um as an undergrad, you know. And I think I had a similar experience of what you said this today, yeah, in my clinical posting today. And I want to draw out a question from there. Does operating in a culture of blame cause lab staff to hide near misses or minor mistakes out of fear, ultimately making the lab less safe?
Yes, I think I touched on that briefly. I said that once helplessness sets in, people want to protect them. So, for example, there and again, I worked in a place whereby this blame culture was really a thing then, and I remember then anything that happens in the lab, our laboratory director was always hell bent on who did it. Who did it? You are going to collect the money from your salary. We're going to do this. You're going to do that. You're going to do that. And there was once I was processing a sample. There was once I was processing a sample, and this sample actually fell from my hands and it broke. Now, there were two things I could have done. I would have just pull up. So, a friend of mine that was an intern like myself was saying, they call me PJ. My name is Praise-Jah. They say, PJ, guy, use your brain. This last FBC sample, just alter am. But because I understood the weight that this carried, I went to go and report myself to the laboratory director. I said, Ma, please, I broke this sample and the blood spilled out. I am doing FBC. Oh, she went off on me. Oh, blah, 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 blah. You have to call the patient. Blah, 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 blah. And as luck we have it, I went down to the reception. For some reason, the patient was not too far. They called the patient again, and we got the sample. You will not believe that this patient had a very high lymphocyte count. Now, if I had just logged the results as my friend told me to do that, I would get in trouble, which I did. I got into trouble. They were saying they were going to give me extension for my internship, but at the end of the day, that didn't materialize. I got into trouble. But imagine if I didn't just take that step to report myself. Or imagine if it was that colleague of mine because of what had happened in the lab previously, and I just put a normal result. What would have happened to that patient? So this is why we need to have these conversations. This is why we need to have these conversations and let things like this podcast be everywhere to let people know that these minor decisions, including the blame game, can kill patients more than it even tries to readjust the sciences that we want to readjust.
Can you imagine when being honest becomes an issue? But I love your decision. You actually saved a life right there. It often feels like structural gaslighting, being told to prioritize strict quality management without being given the manpower or resources to do it, and then taking the fall when things break. How should a scientist undo that kind of a frustration?
You see, you used the word there. You said it feels like structural gaslighting. And please permit me to correct you. It does not feel like structural gaslighting. It is structural gaslighting. And I'll tell you why. You see, you cannot tell people to prioritize strict management when you don't give them the resources to do so. And let's use an illustration, for example. In the engineering field, there's what they call a structural engineer. A structural engineer that was not given enough resources to do the foundation of a building. When that building collapses, is it the structural engineer's fault or that he did not have enough resources? It is that he did not have enough resources. And let's now bring it home. Remember, at the start of this, I said that there are 4 different kinds of pressures that MLS face. We've talked about clinical pressure. We've talked about invisible pressure. To answer this question is broken down into the other 2 kinds of pressure. Volume pressure, we've touched on this before. What's that volume pressure is? You are made to do a lot of samples and prioritize quality management. In fact, you have to run your QC until it passes in the so-called big labs for my chemical pathology folks like me. So we know what we have passed through when we are running QC, and your QC must pass. If not, you're not supposed to start the day. But in that same lab that you are running QC, it is only you that is not just doing the chemical pathology. there is also hematology waiting for you. Now, this means that you are doing one person's work. One person's work is you are doing the job of 3 people in one. Of course, that leads to burnout. Now, apart from this burnout, there's under recognition. They will tell you, what are you using not to press machines? The society will tell you that anybody can press buttons. But then you agree with me that when one person is doing one thing, only him, with no compensation, with no recognition, the law of diminishing returns will set in. Everybody will see the doctor's burnout. Oh. We talk a lot about, when you talk about medical burnout, we talk about the doctors and other people. But nobody sees the people that are repeating an hemolyzed sample just because he's trying to get it right by 3 a.m. Now, another kind of pressure that is affected by this is what we call financial pressure. Still, that's why I said it doesn't feel like structural gaslighting. It's actually structural gaslighting. The ASCP, that is the American Society for Clinical Pathology, came out to say that 55% of laboratory professionals are burnt out globally. Now, this is higher than nurses and doctors in many countries. But I raise you one. In Nigeria, we don't have an accurate statistic, but I am very sure that in Nigeria, that number is more than 80% burnout. You know why? Because we are not just tired. We are tired and broke. We are underpaid. And now that leads us to the other kind of pressure that is linked to this structural gaslighting, as you mentioned, is now the financial pressure. Many MLS earn wages that should only be paid to unskilled workers. You see your mates that did 4-year courses working in financial institutions, and then they can buy you. They can pay for your salary with chicken change. Hazard allowance. If they tell you how much hazard allowance is, sometimes you will ask yourself whether the allowance is even enough to eat rather than take you off an hazard. Now, the so-called big labs, and please, I'm not going to mention names here, they will stuff their labs with the best analyzers, with the best microscopes. In fact, microscopes that you can see your future if you just focus it. But still, they underpay the scientists. And they fail to realize that when you underpay someone that is offering value, you cannot get the most value. And that's why there's the Jackpot syndrome. From 2020 to 2022 alone, it was reported that over 25% of the Nigerian medical professionals are left. Now, those that have refused to jackpot have side hustle. We all have side hustle. And I'm very sure that you rarely meet a medical laboratory scientist that is actively practicing in Nigeria that does not have side hustle. But when somebody has side hustle and they are calling you, Mr. Emeka, the shoe consignments don't come, but you are doing glucose tests. Are you going to be sure of where you put the aliquots? These are the problems when people have side hustle. Apart from that, some that have stayed now battle resentment. You cannot tell me that somebody's mind will be on getting his proper results when they are calling him that his child is out of school. When you come back home and you don't have rent you cannot even pay your rent. So when I say that when we have identified it as structural gaslighting, and then you're asking what can the scientists do, there is nothing the scientists can do because it is not a personal problem. It is a structural problem. And now, when there is a structural problem, we have to fix the structure. We have to fix the foundation. It is not the engineer's fault here. It is that the resources were not put in place. And I think we'll talk about this more when we are coming to the Reclaiming the Scientist segment. What can be done to the structure so that this structural gaslighting stops, so that scientists are not viewed as lazy, so that scientists are not viewed as people that are greedy, they are demanding too much. What are they even doing? What can be done to make sure that this structural gaslighting stops, to make sure that this financial pressure stops, to make sure that this volume pressure on the scientists stops? And I believe that we're going to come to that. But as I said before, there's nothing the scientists can do. We just have to fix the structure.
Okay, and we are coming to that because, even after all that's said and done, we still have to look at how to reclaim the scientists. And we have scientists and interns currently listening to us right now who feel completely drained and disillusioned by the profession. So, what are some of the practical and immediate ways to protect their mental peace?
Thank you very much for that question. We cannot just be ranting here. It's not all doom and gloom if you don't offer solutions. In preparing for this discussion, I itemized the solutions to for the mental health struggles for the Nigerian MLS into four. And before I answer that question, I will outline the four. Then I will pick out the one that interns and scientists listening to us can do for themselves. The first thing that I want to do is to fix the structure. We need to reframe the status quo. And now this one is for the country heads, for the at the administrative level, the Nigeria MLS Council, the Ministry of Health. They need to reframe that status quo about and reshape the way medical laboratory scientists are viewed. Now, the second level for the solutions is the lab management level. The owners of these laboratories, they need to now put in structures and resources in place to make sure that medical laboratory scientists are appreciated and should reduce their pressure. Note, we cannot eliminate pressure. We can only reduce it. Reduce it up to a minimum that will not affect patients' care. Now, a third one is lab staff level. What can we do in the lab? The people that are managing the lab directors, the senior colleagues in the lab, what can we do to make sure that this pressure is lower? And the last one is the answer to your question, the personal level solutions. So, dear interns, dear junior colleagues, dear senior colleagues, dear colleagues of mine that are listening to this, if the system will not help you, please, you have to help yourself. You see, after you perform any analysis, do what we call a 60-second breathing technique. You breathe in and out. You take deep breaths. You've done something. It is okay. Sometimes just acknowledging that, oh my God, I finally found the malaria parasite after looking on nearly all the sides of the slide. I was looking for Jesutomisin hematobium and I saw it. Oh, this is nice. Okay. Just acknowledging your small wins helps. Another thing you can do at the end of the day, itemize at least 3 things you have done right at the end of your shift. It is not possible to come to the laboratory and you've not done anything right. What if that time that you have looked for a patient result that was missing? What of the patient? What of that small child that was afraid of collecting sample and you smiled to the child? Maybe there was one sweet in your pocket and you gave the child and you collected that sample. Just itemize 3 things every day that you have done that is good before leaving. And lastly, please talk, speak up, speak to colleagues that if you are going through something, see, oh boy, it's not easy for me. Like, it's not like speak up. And if you can afford therapy, please go for therapy. You see, therapy is not weakness. So it is only recalibrating us. In the lab, we do QC, we do recalibration for our instruments. We need to recalibrate our mind sometimes. If you are open to leave, if they tell you, okay, you have 1 month leave, you are not the strongest person, take it. Sometimes take 2 days leave. Just rest. When you rest, you will come back. So on a personal level, please, you can do as I've itemized 60-second breathing technique. When you feel tense, you breathe 1 minute, just keep breathing, taking deep breaths. 2, name 3 good things you have done at the end of the day. 3, talk to people. Talk to your colleagues that have faced it. Listen to podcasts like this. Join the conversations like this when we talk about them. Then 4, if you have money, go for therapy. If you don't have therapy, talk to someone. If it's your wife, if it's your boyfriend, if it's your girlfriend, talk. Therapy is not weakness. It helps you recalibrate the mind and then you will reduce pressure. If they cannot help us, we will help ourselves.
I really love that concluding statement. If they can't help you, to every scientist, to every intern listening, you should help yourself. I wanted to ask, what's one thing you would want to advocate for, a major policy or a regulatory change by the MLSCN to explicitly address workplace wellness and mental health support? What's that one thing you would advocate for?
If you ask me, it will not be one. And if you tell me to advocate, I'll advocate for 10. But I'll summarize it for the sake of this podcast. You see, I started my solutions by saying that the MLSCA, Ministry of Health, and at the federal level have the biggest part to play. They need to reshape and reframe the status quo of people about MLS. We are not just the lab guys. We are not pushovers. We see, we are diagnosticians. We are people that make sure that 70% of medical decisions are made. We are not button pushers. We are not lab guys. When they stop making sure and not making some other people in the medical space refer to us as that, one, that's the first step. Two, they need to make sure that they put in the right policies that will protect us. There's a lot of quackery going on out there. Why not they clamp down on these labs that are doing quackery? Someone studied microbiology, someone studied biochemistry, is setting up a lab and pushing out samples. But my friends, my colleagues, me and you agree that the most important is that they should pay us well. You see, other associations and councils, our doctor folks, our pharmacy folks and all, they have the limited amounts that you can pay a professional in their field. But in our profession, it's so bad. If some of us, if you speak to our eastern folks, those of us that are in the eastern part of Nigeria, when they tell you how much they are being priced, you will cry. What if they set a limit that you must not pay a medical laboratory scientist that is licensed by the MLSCN and is paying his annual licensing fee below this level? And auditing is done. When you want to come and renew your license for your laboratory or your hospital, if they find out on your payroll list that you are paying these scientists below this level, immediate sanctions. When we build the framework, make sure that the perception about MLS are changed. We make sure that MLS are appreciated, even among our fellow medical brothers and sisters. We make sure that the pay is something to write home about. I am not coming home and I am already building resentment about going to the lab tomorrow. When we do this, when MLSCN does this, believe me, this will make sure that this mental stress is reduced. As I said before, we can't totally eradicate it. Even in the best climes, it is there, but we are going to reduce it.
Thank you so much for that wonderful response. Thank you so much. So also, do you think that setting strict legal limits on sheet length and sample to scientist ratio is a realistic solution, especially in our climate, to curb laboratory burnouts?
Yes, I'm sure the laboratory management guys and those that set up laboratories will lie to you that, we are not making so much money in this place and we cannot be employing people that we do shifts and all. But it's a lie. Believe me, go and fact check me if I'm wrong. In nearly every health institution, the laboratory makes up to at least 40% of the total money going into that institution. That's if they have a specialist hospital. That means the laboratory is making a lot of money. But why can't they now employ a lot of staff? Now, when you employ a lot of staff, you reduce the shifts. Now, if there's a legal limit on how long a medical laboratory scientist can work before it is said that, okay, this person must go off work, it will help reduce it. Then the sample, you always talk about doctor to patient ratio. It's all there. Me and you agree. If you type doctor to patient ratio in Nigeria, you will see it. But please, I dare you, type sample to scientist ratio. There is little or no data on it because it is not prioritized. In our clients, we need to prioritize simple sample to scientist ratio. Licensed scientists, by the way, because there are many quacks out there, and it is very, very feasible. If the appropriate authorities put this legal limit, enforce it, that this is what should be done, and we put this sample to scientist ratio, that a scientist is not employed because of how much they are going to be paid. It's employed according to the workload and the quality they provide. Then we are going to be able to have these conversations again. Then the shift lengths are going to be realistic. And any defaulting lab, please, they should shut them down. Because, as I said before, we are not pushovers. We are professionals.
Absolutely. We are not pushovers. We are professionals and we are valuable, okay? Yeah. So I hope you didn't forget our game. So it's time for the answer review. Yay. So let's return to our game from the beginning, okay? Which statement was lie? You remember that it was 2 truth and 1 lie. So statement 1, shift length and anxiety risks is actually true. I hope you got it right. Statement 3, 75% weekly burnout rate. Tragically true. And if you choose statement 2, medical laboratory professionals have lower distress because they don't see patients as the lie, you will be absolutely correct. So just because we deal with tube slides instead of the word codes doesn't mean we don't carry the second trauma of every critical result we pass. So on this note, we'll be closing the curtain on today's episode. Oh, we have such a wonderful guest, and you can feel the energy, you can feel the passion, and the vulnerability to which he answers the response. Thank you so much, scientist Praise-Jah, for being vulnerable with us and shedding light on everything, every nook and cranny, I would say. Thank you so much. That was so brilliant.
Very welcome. You're very welcome. I would say that a crisis is a crisis because we've been silent. And I'm happy that we're speaking because the numbers that we push out save lives. But we can only save lives if we are well, not just physically well, but mentally well. I want to thank LabCast and you guys are doing a very good job. It's the second time I've been here and we've been talking a lot about things that really affect us. Thank you guys for doing this. And we want to encourage you that you should keep doing this. I'm always available if I need to be called. And please, my dear colleagues out there, we need to talk. We need to be well.
All right. To everyone listening, whether you are on the bench, whether you are in the research room, whether you're on your way home from, a top shift, or whether you are even a student, who is being groomed in this profession, I want you to know that your work is invaluable, but you are irreplaceable. Take care of yourself first. Like our guest speaker mentioned, the fact that we need, to take care of ourselves even when the profession is not providing the opportunity. Yeah. So take care of yourself first.
Thank you for tuning in to LabCast episode. And if this conversation resonated with you, which I'm very sure one way or the other it has, please share it with your lab network, your friends, your colleagues, and join the discussion using hashtag LabCast. You can also send an email to us for your thoughts, your suggestions, questions at medlabconvolabcast@gmail.com. And follow us on all social media platforms at medlabconvo. And until next